Welcome to Project First Line Rhode Island's refresher training on transmission-based precautions for school-based clinics. My name is Karina Descartes, and I'm the Project First Line Rhode Island team lead, and I'm happy to be hosting this training for you today. On behalf of Project First Line Rhode Island, I'd like to thank each and every one of you for your presence and your work in our community. And before I invite our lead trainer for today and our medical director to introduce themselves, I'd like to invite you all who are participating in this webinar to introduce yourselves as well. Go ahead and type your name in the chat box, your role in your school or organization, if that's comfortable for you, where you're coming from in Rhode Island or elsewhere in the country as you join us today. We're delighted that you've joined us. And while you're doing that, I'd like to welcome other members of our team and our partners from Rhode Island Department of Health who are here in support of this webinar. Abby Anderson is behind the scenes, and she will be connecting with you on chat. Now, I'd like to invite Dr. Alexis Kearney and Ms. Allison Thurber to introduce themselves.
Hi, everyone. My name is Alexis Kearney. I'm an emergency medicine physician and serve as the consultant medical director for Project First Line. And I'm super excited to be here with all of you today.
And hi, everyone. My name is Allison Thurber. I will be your infection prevention training liaison for this session.
All right. Thank you, Dr. Kearney and Ali. Next slide, please. Once again, for those of you who have just signed in, I see folks still trickling in. Welcome. And you are in a refresher training course on transmission-based precautions for school-based clinics by the Project First Line Rhode Island team. Next slide. For our agenda after this introduction, Ali will walk us through today's learning objectives. Then we are going to review the 5 elements that cause infection. And then we're going to talk about pathways of infection. We're going to talk about SARS-CoV-2, of course, SARS-CoV-2 transmission and the lessons that we've learned from that. And then we're going to focus on transmission-based precautions. And then Ali's going to bring up a couple of case discussions for us. And then we'll have some brief announcements before we focus again on the Q&A. And then we'll have, at the end of the session, before you log off, we would request that you answer a 3-question poll. This will help us improve on our future sessions. Next slide. These are our partners in support of this session, and we are about to begin. But first, a little bit of housekeeping. Everyone is muted at this point except the training team. And if you look at the bottom bar of your Zoom app, you will see a Q&A box, a chat box, and a hand raise icon. For the Q&A and discussion at the end of this session, please use the Q&A box to send your questions or use the hand raise button to be unmuted. If you have any questions about what is being discussed at any point, please feel free to type them in the Q&A box, and we will field them for a Q&A as mentioned for later in the session. Please use the chat box to type your email if you wish to be included in our email list for updates. Today's session is being recorded. And now here's Ali Thurber to begin our session.
All right. So hi, everybody. I wanted to thank you first off for having me again today to lead our refresher training session on transmission-based precaution for school-based clinics. My name is Allison Thurber, and I'm a nurse at the Rhode Island Department of Health, and I also second as a trainer for Project First Line Rhode Island. I started off my nursing career working with the pediatric population, inpatient neurology, long-term care, and emergency care. I also had the opportunity to pick up some substitute school days as a nurse throughout the state of Rhode Island. So through this, I saw that school nursing can be a very different experience than other nursing specialties because often you're the only nurse. There's no other healthcare staff in the school. You don't have another nurse in the other room to ask a question to or a suggestion. In the least, a colleague, maybe a phone call away. So you rely on your experience, your intuition, and your natural supports in the community. I've also seen firsthand the challenges nurses face due to student population sizes, language barriers, health inequities, and social injustices affecting student health and attendance, physical building limitations, as well as a spectrum of support from school communities in which you work. So with all that said, I'm super happy to be with you today and hope that throughout the presentation, you all take the opportunity to engage and share your experiences and knowledge with your fellow colleagues. So we'll just start with some session objectives for today. So our first objective is to understand the 5 elements that cause infection, then to list the 4 pathways of infection, to understand how COVID-19 has changed the way we think about pathways of infection and precautions, to understand how pathways of infection relate to transmission-based precautions, and then to share and learn from our other colleagues while discussing case scenarios and clinical modifications in the school setting. So germs. Germs are a part of everyday life, and they're found in our air, soil, water, and in and on our bodies. Some germs are helpful, however, others can be harmful. And most of these germs that live on our bodies don't cause harm, but a small portion of these germs are known to cause infection. So here we are used to seeing the epidemiological triangle, but we are going to go over 5 elements that are necessary for the transmission of germs: reservoir, person, pathway, defense, and germ survival. So the first is germ survival. Germs need to be able to survive in an environment so that they can eventually cause infections. Reservoirs. Germs also need a place to live, and these places are called reservoirs. So there are 4 reservoirs that can be found in the human body: the skin, the digestive system, also known as the gut, the respiratory system, and blood. And then there are 4 reservoirs that can be found in the environment: water and wet surfaces, dry surfaces, dirt and dust, and devices. So then germs also need a pathway. Germs are transmitted to people via 4 main pathways. These are touch, splashes and sprays, breathed in, and through clinical care. And while people are exposed to germs frequently, most do not make us sick. Germs need to be able to get around the body's defenses to cause infection or illness. An example of this could be a scrape on the playground that leaves the skin open and vulnerable to infection, or an underlying medical condition that leaves kiddos and colleagues immunocompromised, like lupus or cancer. Then they're more susceptible to illness than others. And lastly, a germ needs a host. Once a person is infected with a germ, that germ then has a host. So throughout the webinar, we will have a couple of poll questions for the group just to check our new understanding of concepts or current knowledge. So the poll question will pop up on your screen. You should see it right in front of you, and we can read it together. What you do is simply select your answer when you have chosen which one that you'd like, and then it'll tally them all up and just give us a general sense of how everyone's feeling about the question. So first question here: what elements are needed to cause infection? Host, transmission, reservoir, breakdown of defense, germ survival, all of the above. Go ahead and take some time to answer that. Great. So it looks like everyone selected all of the above. Just what we went over are 5 elements that are needed to cause infection: our host, transmission, reservoir, breakdown of defense, and germ survival. Alrighty. So I would like to dive deeper into one of those elements that we just mentioned about how germs spread. And this is the pathways of infection, also known as transmission. So at the top of the slide, you can see the traditional way of categorizing infection pathways, where organisms were thought to be transmitted 3 different ways: contact, droplet, and airborne. And this is a concept that I'm pretty sure everyone's familiar with. Now, CDC has shifted to a more fluid model where the pathways of infection into the human body include touch, splashes and sprays, breathed in, and it also acknowledges that there can be infection transmission as a result of clinical care. It's important to know that certain germs can fall into one, multiple, or all of the categories. So our first pathway, touch, can be through direct touch or indirect touch. Direct touch occurs when microorganisms are transferred from one infected person to another. Examples include holding or shaking hands or taking a pulse. Indirect touch involves the transfer of an infectious agent through a contaminated object. So an example of this could be someone ill touching a desktop or doorknob and then another person touching that same object. Examples of infection that can be transmitted by touch include scabies, MRSA, norovirus, and other enteric illnesses. There's also many more. We've just tried to kind of isolate it to ones that you would typically see in a school-based clinic. So next we have the pathway splashes and sprays. The splash and spray pathway occurs when infected particles travel from one person to another through the actions of sneezing, coughing, spitting, vomiting, any other action that you can think of that projects body fluids. These particles carry infectious organisms that can reach your eyes, your nose, and your mouth. And some infections that can be transmitted via splashes and sprays include the flu, whooping cough, norovirus, and mumps. So the third pathway here is breathed in. And breathed in is how smaller particles and aerosols are spread. These particles can linger in the air longer. They also have the potential to reach a further distance because they can be spread via coughing, sneezing, breathing, talking, and during and after respiratory treatments like nebulizers. Some infections that can be spread when breathed in are tuberculosis, measles, chickenpox, and COVID-19. So the fourth pathway is clinical care. So the clinical care pathway is when there is a breakdown or bypass in the body's natural defenses, either by medical complication, procedures, errors, or by negligence. So think of how some medical procedures or interventions can provide a pathway for infection simply by providing portal of entry into the body. Some ways this may happen could be a provider not washing their hands in between tending to sick students. Sorry, I think I just went ahead in the slide a little bit, but that's okay. Not following proper technique when straight cathing a student, or a break in the skin when giving a vaccine. Examples of infections that can be caused by clinical care include, and they're already on your screen there, catheter-associated urinary tract infections. I know that some school nurses have students they routinely assist with cathing. Norovirus from potential environmental cleaning breakdowns, and the spread of flu or RSV through ineffective hand hygiene or ineffective mask use. So now we will talk about everyone's favorite, least exhaustive topic, COVID-19. So we've come to understand that the transmission of SARS-CoV-2 falls more under a spectrum of pathways, and it's dependent on a few things: the size of particles being emitted, the amount of time these particles remain suspended in the air, and the environment or physical space that you're in. When considering the pathways of COVID-19, we understand it can spread from touch, either directly or indirectly, having contact with an infected person, or by objects to mucous membranes or breaks in the skin. We have come to know that throughout the pandemic, this pathway is less of a risk than originally thought. And I'm thinking back to the days when people would wipe down their grocery bags after being delivered, or withhold touching mail or packages for weeks for fear of contamination. We also know it can be spread by splashes and sprays directly into mucous membranes, for example, sneezing. It can be spread by breathing in the virus, like talking, or when aerosolized by a nebulizer treatment. And then lastly, it can be spread by clinical care. So this could be inadequate hand hygiene or mask wear, or a lack of protocol or isolation from those who are ill. So again, our understanding of SARS-CoV-2 transmission has developed and changed over the course of the pandemic, and will surely continue to do so as we learn more about the virus moving forward, just like many other infectious organisms that we've come to know. So transmission-based precautions. A germ's pathway helps us to determine what type of precautions we need to take in our practice to protect ourselves and our patients that we take care of. So we're going to start our section about precautions with the first concept of source control, and just take a minute to self-reflect. So what do you know about source control? Maybe source control is a concept that you have heard of in passing, but haven't really had to define. Or maybe like myself, you understood the concept or idea, but didn't actually think it had like a formal title associated with it. So we're going to watch a short 4-minute video from CDC's Project First Line's Dr. Abigail Carlson, explaining source control and how it relates to our practice.
Welcome back, everyone, to Inside Infection Control, our video series here at CDC's Project First Line. I'm Abby Carlson. I'm an infectious diseases doctor at the CDC, and it's great to have you with us. We have talked in previous episodes a lot about the different actions that we can take to keep germs from spreading, in healthcare in particular. And source control is one of those important actions. But what exactly is source control? It's a concept that we come back to a lot because it's that important, and it starts, not surprisingly, just like its name, at the source. You're stopping germs at the source before they can spread to other people. We talk about source control as an important tool for COVID-19 to reduce the spread of COVID-19 and other diseases that travel in respiratory droplets. And we're going to focus on that today. But keep in mind, source control is important for a lot of other diseases too. One example is shingles. We cover the spot where a shingles rash is, which keeps virus from getting from the rash into the air or onto other surfaces in your environment where it can spread and it can infect people. That's source control for shingles, covering the rash, the source. In COVID-19, source control focuses on covering the nose and mouth to keep your respiratory droplets out of the air, because that is the main way that the virus that causes COVID-19, SARS-CoV-2, gets from person to person. Masks that fit snugly around the cheeks and our chin are the main way to do source control for COVID-19. A mask that fits well covers your nose and your mouth and blocks those respiratory droplets, which are traveling in the air when you breathe and which have virus in them if you're infected. This means that those droplets, when they're covered up with that mask, are much less likely to reach other people around you and then infect them. And if you're caring for a patient with COVID-19 and you're using an N95 respirator and not a mask, most N95 respirators that we use in healthcare are also good at blocking your respiratory droplets from breathing out into the air. So with most N95s, not only are you protected from the virus that your patient is breathing out, but your patients and your colleagues, if you're infected with any virus, are protected from germs that you might breathe out. All of this source control is important for COVID-19 because we don't always know who's infected. Other source control methods, like in the shingles example, depend on knowing that the patient is infected and knowing what to do. For example, covering a wound because you've seen it, you know it's there. COVID-19 is different because we have patients who are asymptomatic, which means they can be infected, but they may not show it yet, and we may not be aware that they or we, if we're infected, can spread the virus to others by talking, breathing, singing, and other activities that use our breath. We'll talk more about this in another episode, so please stay tuned for that, because asymptomatic transmission, asymptomatic infection, is an important thing. But this spreading of infection when you don't have symptoms, it's one of the biggest reasons we have everyone wear a mask that fits well when they're in the healthcare setting, and also when you're out in the community. So you can see why source control is an important tool in healthcare and in the community for stopping the spread of COVID-19 and other diseases that travel by respiratory droplets. As always, thanks for joining us. Please be sure to follow up with us on Facebook, on Twitter, we're on YouTube, and of course we're on the web, cdc.gov/Project Firstline. We will see you back here for the next episode.
Alrighty, so thank you to Dr. Carlson for a great summary of source control and some of its implications. So let's continue our conversations about how we can protect ourselves in schools and communities. So we're going to have another poll question. Should pop up. There we go. What actions are part of standard precautions? Hand hygiene, a clean and disinfected environment, respiratory hygiene, cough etiquette, none of the above, all of the above. Alrighty. So it's like some put hand hygiene, most others put all of the above. So the correct answer here is all of the above. Hand hygiene, a clean and disinfected environment, and respiratory hygiene / cough etiquette are all encompassed under standard precautions. So standard precautions are the minimum infection prevention standard for healthcare workers in all healthcare settings. These practices are used to prevent transmission of diseases that can be acquired by contact with body fluids and blood. So think of all your students as being potentially infectious. Little petri dishes, I like to say when referring to my daughter and all her many friends that come over. No matter how emergent you feel the situation is, adhering to standard precautions is critical to protect yourselves as well as the other students and people that you care for. So some examples of infections that can be prevented by adhering to standard precautions include bloodborne pathogens and cellulitis. So standard precautions are frequently where healthcare workers tend to get a little more complacent. We're so busy, so the extra few minutes to wash our hands more thoroughly or make our way over to the sharps container can seem like the least of our worries, but it really is the small things that we do day to day that can make a large difference in the control of infection. Standard precautions includes first hand hygiene with soap and water or an alcohol-based hand sanitizer. Then it also includes the use of personal protective equipment like gloves, masks, and eyewear based upon the anticipated risk. So for example, if you're removing a tick and you may want to don gloves to decrease the risk of bloodborne pathogen transfer when you're in contact with that attachment site, if there may be blood. It's all about anticipating what may come. Respiratory hygiene and cough etiquette is also included here. And I know this is big with little kids. Constant reminders to sneeze into their elbows, wash their hands, wipe their runny nose with tissues. It also includes providing space for and encouraging staff and students with symptoms of respiratory infections to distance from others and remain home when they're ill and stay home when they're ill. It includes safe injection practices. In some aspect, most of you use needles and syringes throughout the day, maybe insulin, hopefully not frequently, but an EpiPen or hosting a vaccine clinic. So this includes not recapping after use, using built-in safety mechanisms to help protect yourself, and maintaining care of the sharps container. Sterile instruments and devices. So cleaning and disinfecting environmental surfaces and high-touch surfaces that harbor germs, like keyboards, phones, tablets, writing utensils, doorknobs, desks, anywhere that is a high-touch surface that kiddos are touching all day, wiping those down and disinfecting to make sure they're not a reservoir for germs. Laundry. Be sure any reusable laundry is brought to a dirty linen receptacle, and when carrying the soiled linen, just be sure you're holding it away from your body and not against. And then lastly, waste management. So waste should be disposed of properly, and if there is waste that is saturated in blood or body fluids, be sure that it ends up in a medical waste bag and not in the traditional trash. So when standard precautions alone cannot prevent the spread of infection, they are supplemented with transmission-based precautions. And transmission-based precautions are always used in addition to standard precautions. It's the second tier of infection prevention, and it's used when patients have germs that can spread through touch, splashes and sprays, breathed in, and clinical care. So here we are going to review the classic division of transmission-based precautions in healthcare. Just like our pathways were, these transmission-based precautions are in the process of being rewritten by CDC, but for today's purposes, until the new version is released, we will still use the standard 3 categories. So first, we have contact precautions. And contact precautions involves hand hygiene before entering and leaving a room, gloves and gown with direct patient care, and the use of dedicated or disposable equipment. Also making sure that you're cleaning and disinfecting reusable equipment before you use them on another person or student. And there is droplet precautions. And droplet precautions involves hand hygiene before entering and leaving a room, or before and after taking care of a patient. You're not entering a room and leaving a room. Covering your eyes, nose, and mouth before room entry by the use of goggles and mask or face shield and mask to protect all your mucous membranes from potential pathways of transmission. And then finally, airborne precautions. And airborne precautions involves hand hygiene before entering and leaving a room, donning a fit-tested N95 or high-level respirator, and a door to the room, if the patient's in a room, must be closed for the germs that remain suspended in the air. They don't leave that room. So pathways of infection determine what transmission-based precaution to use and can indicate more than one precaution. So an example of this could be influenza. Recommended transmission-based precautions for flu are standard and droplet precautions. So the flu can spread predominantly by way of breathing in and by splashes and sprays. So because splashes and sprays can spread and get into the mucous membranes. If your contact with a flu positive patient is close, then you may want to consider wearing eye protection or a gown to prevent from splashes and sprays entering your body and clothing, in addition to the recommended gloves and mask wear. So back to COVID-19. Now that we've talked briefly about pathways and how SARS-CoV-2 is a unique virus, since its pathways don't fall neatly into one category or another, we are going to continue that with our COVID-19 precautions. So COVID-19 precautions is what we use to describe the specific actions that healthcare providers like ourselves need to take to protect from the virus. And again, like Dr. Abby says, this takes in the idea that there can be asymptomatic transmission, and we don't know if someone is infected. We do know that depending on the situation, SARS-CoV-2 may be transmitted via splashes and sprays, may be breathed in, maybe via clinical care or touch, as well as anywhere on that spectrum across these pathways. So the precautions that we'll highlight in the next slide are inclusive of this understanding of how it's transmitted and asymptomatic transmission. The precautions cover all possible scenarios in the spectrum, including contact precaution, droplet precaution, and airborne precaution. All right. So in this slide here, you can see the PPE recommendations for healthcare workers in respect to COVID-19 precautions. And again, this is taking into account that you can spread it asymptomatically, and we don't know if people are infectious sometimes or ourselves. So for patients with confirmed or suspected SARS-CoV-2 infection, CDC recommends that healthcare providers use N95s, being that they offer the highest level of protection, along with eye protection, gown, gloves, depending on the type of care. This recommendation is for all community transmission levels. So again, if you have a patient you suspect SARS-CoV-2, you should be donning gown, gloves, eye protection, and a N95 or higher level respirator. If a patient is not suspected or confirmed to have SARS-CoV-2, this is where the PPE recommendations vary a little bit. And this is here over in this column all the way to the side. So in the low and moderate community transmission level, source control is only recommended. So remembering what we learned from Dr. Abby's video, source control is stopping germs at the source before spreading to others. So source control in terms of COVID-19 is a surgical grade mask. Then you can see that in the substantial and high community transmission level, the healthcare worker will use eye protection and source control. So again, for healthcare workers, community transmission determines PPE use in the healthcare setting, mostly because of that asymptomatic transfer. It is consistent with suspected or confirmed diagnosis, but varies when COVID-19 is not suspected. So CDC has a community transmission tracker on their website, and I will have Abby add that into our chat box for your reference if you want to use that. When you go to the tracker website, you will see a map where you can click to get a more specific snapshot of what the COVID-19 transmission is in your community. And this is updated weekly. Transmission is calculated based upon a couple of things happening in each area. The number of new cases per 100,000 persons in the past 7 days, and the percentage of positive tests during the past 7 days. And then they will kind of color code it for you. So before we summarize our session today, I'd like to spend some time sharing our thoughts and experiences through some case discussions. So our first case discussion is a 5th grader that comes to the office with upper respiratory symptoms of cough, sneezing, and chills. I would first like to discuss what pathways of infection we're considering with these symptoms, and then what transmission-based precautions you plan to use. So please raise your hand to be unmuted, or you can write a response in the chat box that we can read out loud. So I'll give you all a moment to respond and choose how you're going to either raise your hand or write your response in the chat box. So it looks like someone said droplets. So someone else said all airborne. Yep. So again, going with what CDC has newly released. Our pathways of infection that we're thinking about are touch, splashes, sprays, and breathed in, which, yes, it encompasses all of what was included sort of in airborne. But so from here, respiratory and contact. From here, transmission-based precautions that we would use could be those full precautions. So airborne precautions, it would be appropriate to don gloves, a mask. Also think about gown and eye protection if you're going to be in close distance with that patient, and possibly having some splashes and sprays. Anything in your school-based settings that make it particularly hard, and this would be very individualized, but that make it hard to respond to kiddos with respiratory infections? Do you have the spaces that you need? Do you have the resources that you need and the supports that you need? If anyone feels comfortable sharing that. If you don't, that's okay. I will plug along, but still allow you to write in the chat here if you want to add anything to this discussion here. Okay. So our next case discussion is a student that is sent to your office after vomiting in the cafeteria. I would like to touch upon special considerations for vomiting and diarrhea, and then also relate that to what pathway of infection you may be concerned about. So again, you can raise your hand to be unmuted, or you can write a response in the chat box, and we can read it aloud and discuss. So someone wrote contact, or worried about contact. I'm assuming that's contact precautions. So let's see, contact, droplet, contact standard. Standard precautions will cover everything. And then we also want to take into consideration contact precautions and droplet precautions. So in the situation of any sort of enteric illness, particularly if we think it could possibly be norovirus, that can be extremely infectious in small amounts. So you do want to increase your frequency of cleaning and disinfecting, and that would be the kind of considerations I was getting at with what would we consider with vomiting and diarrhea. Make sure that hazardous wastes are cleaned up thoroughly and appropriately. So EVS workers, teachers, aides, nurses, whoever's responsible in your facility for cleaning up waste should don appropriate PPE that takes into consideration touch and splashes and sprays. Because it spreads so easily, you also may want to keep a close eye on students that were present in the area for that lunch period, in that classroom or shared space. Make sure that they don't become ill as well. And again, I'll ask, and you can write it in the chat if you feel comfortable, but are there any barriers in your school that make it more difficult to provide that care that you need to someone who has vomited in a public setting, in a classroom, in the cafeteria? So this is the last of my slides, and then I will hand it off to Karina to do some of our housekeeping, closeout, and Q&A. But again, I want to thank you all for engaging in conversation, sharing your thoughts with your colleagues in this space, and hope that, if nothing else, we were able to create a comfortable environment to learn and share ideas and experiences. So some key takeaways from today's session. There are 5 elements needed for infection to occur: a reservoir, pathway, person, breakdown of defenses, and germ survival. The pathways of infection include touch, splashes and sprays, breathed in, and clinical care. SARS-CoV-2 has taught us that organisms do not always fit into one pathway or transmission bucket. That the pathways of infection help healthcare workers and public health decide what transmission-based precautions and levels of PPE are needed for a specific organism. School-based clinics differ from traditional centers for healthcare, like pediatric offices and inpatient facilities. Therefore, we have different challenges to care. So again, thank you so much. And I'm going to hand this over to Karina to go over some of our admin follow-up and Q&A.
Thank you, Ali. For those who opted for, can we go to the next slide, please? Thank you. For those who opted for certificates of training, they will be emailed in PDF after the post-session survey closes next week. And as a reminder, it closes midnight on November 21st. So that's next Monday. Post-session survey link will arrive in your emails tomorrow. This is a very similar survey to the pre-session survey that we've sent out after you registered for this webinar. PowerPoint, post-training materials, and links to resources will be emailed as well. And that will be sometime this afternoon. If you have not received them by end of today, please reach out to us so we can promptly resend. Next slide. And if you want to be included in our updates via email and you have not already, again, feel free to type your emails in the chat box or send us an email directly. And our email is found at the top of this slide, top left of the slide. We are also on social media where we announce anything infection control, any updates that we have from the team and for the community. And on December 12th, if you have family, friends, or colleagues who work in EMS, emergency medical services, we have another webinar. This time it's a 60-minute Zoom refresher session, also transmission-based precautions, but specific to EMS needs. Please help us spread this webinar far and wide. And this webinar will be presented by another one of our infection prevention training liaison nurse, Lisa Ledoux. Next slide, please. These are our references for this training. And next slide. And I would like to invite back on camera Ali and Dr. Kearney for a few minutes of Q&A. And to our attendees, you can raise your hand and we'll unmute you and you can speak directly or type your questions in the Q&A box. And again, thank you everybody for your participation and questions today. Before you go, please take a few seconds to answer these 3 questions you are now seeing on your screen. It's very quick. And it will inform our team on how we did today and will help us improve. So I appreciate it so much if you could fill that out. Thank you.